Good afternoon, everyone. This is the November 17, 2023 meeting of the House Bill 737, Commission for the Study of the Environmental and Health Effects of Poly and Perfluorinated Chemicals. And we have a quorum. I welcome Representative Murphy. Good to see you. It is about 1:03 p.m. and we can begin with our agenda. First on the agenda is approval of the October 13 minutes, and those would be as revised on October 15th that I had sent out. Gary.
Oh, you're muted, Gary.
That better? Sorry about that. Maybe I'm better unmuted. On page 2 under wetlands, the second paragraph, I think under the second paragraph under wetlands, I made a comment about SCOTUS and the Chevron decision. It doesn't really read quite right. SCOTUS, all of it should be, SCOTUS should be all capitalized. And the word deference should actually be decision. It really doesn't make much sense. And maybe
okay, it would make sense to me, but it might probably not to you. Let's see.
Perhaps that little section should read the SCOTUS decision in the Chevron case. That might, but the way it reads, it doesn't. Deference doesn't mean anything.
Okay. Any other comments? If not, I will entertain a motion to approve as amended.
So moved. Second.
So moved by Nancy, right? And seconded by Rosemary. All those in favor, please indicate by raising your hand. See them. Do we have anybody on the phone? Ron or Rich Lascelles, are you there?
Yes, this is Rich Lascelles. I'm on the phone.
Okay. And how do you vote on that?
Aye.
Aye. Okay. So that passes unanimously. Moving right on to our updates. Mr. Wimsatt.
Yes, good afternoon, everybody. So just going into our usual update, we start with the Air Resources Division. No update on permitting activities. As far as inspection activities go, Air Division staff participated in a multimedia site visit and tour that we held actually yesterday on the 16th of November. And I'll be talking about that in just a little bit, but there were 2 Air Division staff who participated in that visit. With regard to stack testing, as I've noted, I think previously, the annual stack test took place September 20th and 21st of this year. 2 DES staff members were present to observe, and all indications were that the equipment and the testing went as planned as per the pre-test protocol. And a final report on that is due this month. We don't have that yet, but it's due this month. And then with regard to bypass operations, since the last update to the commission, no bypass events have been reported. In 2023 to date, there were 11 bypass events for an aggregate total duration of 3.5 hours of bypass for the year. Moving on to the plant closure. So I think as I reported earlier, but I'll reiterate, on August 23rd, DES was notified that Saint-Gobain Performance Plastics would be closing the Merrimack facility as part of an effort to restructure its composite solutions business in the United States. Saint-Gobain intends to fulfill its existing orders for that the facility has already taken, and that's at this point anticipated to be accomplished by the end of the first quarter, so by April of 2024. And then the company has indicated that they will continue to work with DES on the ongoing environmental investigation and remediation effort, including providing bottled water and permanent alternate water as appropriate within the consent decree area. Representatives from our Air Resources, Water, and Waste divisions, so all 3 of our divisions, completed a multimedia site visit and plant tour yesterday on the 16th of November. And I was part of that, so I attended that visit. The purpose of the visit was really to allow our staff that are representing a number of relevant programs to view the current plant conditions and to learn more about the company's plans for closure of the facility. The Saint-Gobain representatives indicated during that site visit that their current plans are to remove all materials, waste, and processing equipment from the facility as part of the decommissioning of the plant. That will likely occur between the time that their production activities cease after Q1 and then by the end of the calendar year 2024. So I think their expectation is they will have completed all of that work by December 31st of 24. They have hired Ramble Engineering, Ramble. It's a group, it's an architecture and it's a global architecture and engineering firm to assist them with the work that will go into decommissioning and cleaning the facility. So that I understand they're going to be engaging with them early in December. And for our part, we plan to remain in frequent contact with the company during this shutdown process and during the time that they're decommissioning the plant, with an eye towards really ensuring that none of those activities pose any risks, and also that there won't be any additional risks to human health and the environment for the community following the plant closure and the company's departure from town. So that was a productive visit and helpful, and the beginning of continued communications that we plan to have with the company about their plans for closure. Going on to kind of a waste division update. So Saint-Gobain's first contractor for POET's Second Wind Water System started the POET installation process within the towns of Bedford and Merrimack back in November of last year. And in May of 23, Saint-Gobain finalized the contract with Culligan Water as a second contractor to complete POET installations in Londonderry, Litchfield, and Hudson. And at this time, nearly all the homeowners who have been notified of their eligibility to set up a pre-installation meeting. The first POET system was installed back in December of last year. And as of October 31st of this year, so just a couple weeks ago, 518 POET systems have been installed. At this time, the contractors have been able to install almost all the POET systems for properties where the property owners were responsive to their initial contractor notification letters. Saint-Gobain's contractors begun notifying parties listed under the term sheet attachments 11 through 16, so more recently identified properties for POETs. They've begun those notifications. And they'll also be sending out second notices to the property owners that are eligible to receive POETs and that didn't respond to the initial contractor notifications. As described in the approved work plan for the installation of the systems, Saint-Gobain is responsible for confirmation testing of any system that they install to make sure that the system effluent meets that they're seeing effective treatment and they meet the standards. Due to the requirements of the work plan, so there's a delay in when one is installed and when it's declared complete and perfected, if you will. So at this point, approximately 443 of the 518 systems are considered officially complete because the installation, basically, and the testing was all cleared. So we talked before about the steps that are taken to ensure that the systems are operating properly. So on July 1st of this year, Saint-Gobain started their POET system rebate program for eligible homeowners. And according to Saint-Gobain, the program will provide a one-time rebate of up to $5,000 to homeowners deemed eligible by the company who installed a POET system after their property, who installed a POET system at their property to treat drinking water for PFAS prior to being offered a system from Saint-Gobain. So at this point, the details on the rebate program, there's a link in the notes that you'll see that can show you the site that Saint-Gobain operates that tell the details of that program. They've indicated that they received approximately 30 reimbursement requests to date, and they've reviewed those for eligibility and reimbursement, and they'll be notifying residents of the findings of those reviews during this month, so in November. Saint-Gobain is proceeding with design work for water line installations for the towns of Litchfield, Bedford, and Merrimack. These are areas where either have existing water lines where homes are located nearby and require connections, or areas where and also some areas where new water mains need to be installed. So a notice to proceed for construction was granted in October by the company for the Hillcrest Road area main water main extension in the area in Litchfield. Approximately 1,500 feet of water main west of Meadowcrest Road is expected to be completed this month. And the utility company anticipates completing water service connections for the properties on Shirley Way and Rocky Hill Road this month. And then they expect that the remainder of that work will be completed. It will take approximately 6 months to complete. Saint-Gobain has also been working with the utility company to complete the design for service connections to existing water mains in the towns of Bedford and Bedford and Londonderry. And bids have been received for this work, and the water utility has selected a contractor. And they're working to finalize the contract documents. And construction for this work is anticipated to begin next month in December, weather permitting. Then Saint-Gobain's consultant has finalized design packages for extensions and connections to existing water mains for the Merrimack, Wildcat, and Brenda Lane service connections. And the bid process was initiated on November 6th. The contractors indicated that this will be a 30-day bid process and be awarded before the end of the year. And it's likely that this work will be conducted in early 2024. Both projects are estimated to take approximately 3 to 4 months and be completed by late spring of 2024. Saint-Gobain is working with the water utility and the town of Londonderry to evaluate the feasibility of water line extensions in the town. Conceptual design was completed by the utility on behalf of Saint-Gobain at the end of April of this year. And DES met with Saint-Gobain and the water utility in June to discuss the findings of their conceptual design evaluation and some challenges that were associated with expanding water service in the area. Those I think have largely been resolved. DES is in active discussions with both the company and other stakeholders to finalize the alternate water remedy for that area of the site. So on April 6th of 23, DES received a letter from Saint-Gobain that proposed to delay submittal of their application for a groundwater management permit until completion of the second set of PFAS samples from all drinking water wells at the site. DES concurred that a confirmation sample from all drinking water wells would assist in delineating the boundary of the groundwater management zone and developing the long-term monitoring plan that's required under the groundwater management permit. So DES issued an approval letter back in May and requested that the application for the groundwater management permit be submitted to DES by May 3rd of 2024. So that's still the target date for that submittal. And we know that their consultant has started collection of the second samples back in June, and I'll report on the progress of that in just a moment. So DES has been periodically receiving updated proposals from the company to remedy additional water supply wells within the consent decree area following the initial agreements that we had in April and June of 2022. That includes term sheet attachment 16, which was received and reviewed by DES in September. This attachment includes an updated list of remedies for all properties since the April 22 proposal. So DES anticipates a new proposal will be submitted this month by Saint-Gobain. And then, let's see. With regard to water supply sampling, Saint-Gobain has presented a work plan, as you all know, for residential well sampling and a total of 17 addenda to that sampling plan. We approved addendum 17 back in March. Saint-Gobain's consultant, WSP, has been retesting wells with PFOA results that were between 10 and 12 parts per trillion and sampling additional wells within the consent decree area. results from the initial resampling effort, and I've reported on this, but I like to keep providing it as a reminder. From the initial resampling effort targeting homes between 10 and 12, have indicated that about 30% of the homes that were tested showed an increased concentration over the first result. 29% showed a decreased concentration from the first result, and 41% remained approximately the same. So WSP started the effort to collect a second set of samples from all wells that were previously sampled only once, and that exhibited results from below the detection limit to 10 parts per trillion, so anything from 0 to 10. And as of November 9th, second samples have been collected from approximately 1,070 properties, which represents approximately 90% of the targeted properties for resampling. And the lab analytical results for those second samples from those properties, again, these are properties that exhibited a concentration below 10 parts per trillion in the first sample, have indicated that between 5 and 10% of those resampled have exhibited exceedances of a drinking water standard. And these properties have been issued bottled water eligibility letters. So going to previously unsampled wells within the CD area, we've talked about this before. DES continues to express a need for additional sampling addendum to complete sampling of all water supply wells within the consent decree area. And in a letter dated back in June, we required that they complete the sampling of all water supply wells located within the outer boundary of the consent decree. The company has not agreed to conduct that sampling. And so we met with them back in August of this year on this particular topic. And the outcome of that meeting was that they were to respond to us with this new sampling proposal. We anticipate receiving that correspondence from them sometime this month. So we expect to see that. That would probably come through the Department of Justice, but we expect to see that sometime this month. So going to some of the statistics about sampling, as of November 9th of this year, and this is updated to reflect the Addendum 17 proposed sampling, 3,844 properties have been identified for sampling. That's not a change from our last month's report. 3,833 access agreements have been sent with about a 70% return rate. That's also unchanged. And then 2,449 samples have been collected from water supply wells. That's 16 more than our October report. And then 1,069 second samples collected from water supply wells, the ones I just talked about, the ones below 10. And that includes the 884 of those samples were actually collected during the summer of 23. And then a total of 1,111 properties have been offered bottled water, and that's 12 more than the October report. So moving on to site investigation, a remedial action plan, and we talked about this, it was submitted to DES back in May, and we met with then Saint-Gobain and their consultant in June, and they've decided to submit a RAP addendum following those discussions, and we anticipate receiving that addendum in December of this year. So, and then appended to the notes for this, which you'll receive when you get the minutes, are the usual graphics that help to show what the progress is in terms of getting POETs and waterline connections installed in this most recent part of the agreement. And you'll see from those bar charts and pie charts that I'll just review them briefly. In total, for the number of POETs that have been proposed, about 65% of those POETs have been completed, meaning they're installed and been determined to be, officially implemented. And that breaks down in the towns as follows: about 71.5% of those POETs identified for Merrimack, about 77% for those in Londonderry, about 75% for those in Litchfield, and then about 75% in Hudson. And then for Bedford, it's about 58.5%. So in aggregate, that works out to about 65% of the total POETs that have been identified. And those are represented in different graphics that you'll see with the minutes. And with that, I think that concludes it. I'll be happy to field any questions.
Questions from anyone? Oh, Rosemary.
Oh, thank you. Thank you, Mike. And thanks also for adding the graphics. I really appreciate that. A question, you mentioned that Saint-Gobain is challenging DES's request for additional sampling for wells within the outer boundary. Did they give a specific reason, as if they think there's another source or?
Yeah, their general reason has been that there are, they believe that those wells are located close to other potential sources of PFAS contamination. And to be candid, that's just not an argument that is persuasive to us. And so we'll be doing our best. We're anxious to see what they submit to us in December, and we'll react to that and deal with that accordingly.
Okay, and follow up. They made that same argument for some properties in Merrimack. Gosh, it might be over a year ago, I think. How did that get settled? Were all those I think some of them they relinquished and sampled, but are there still any outstanding challenges to the sampling request?
Yeah, there are properties in Merrimack certainly that are in that category, and that's part of what we're trying to reconcile.
Okay, thank you.
Nancy, you had a question.
Yes, thank you. On that same point, Mike, when Saint-Gobain is non-compliant with those sampling requests, are there any repercussions to them for being non-compliant, or is it just they have the opportunity then to renegotiate what's being asked of them?
This is really about, whether they're complying with existing law and rules and the terms of the consent decree. And in the end, if that's not happening, then there are a number of, mechanisms that DES and the state can use to compel that compliance. And I wouldn't discuss it further than that. But
Thank you.
Mindy, you had your hand up, I think. Go ahead.
How many wells, Mike, fall into that category right now where there's a dispute?
I think it's on the order of something a little bit less than 200.
Does the state have any plans to identify or notify those residences so that at the very least they'll be aware that there's a concern about their water?
Yeah, I think we're looking at this. At this point, we're really looking to get those wells sampled one way or another. So I don't want to say too much, but we're looking to resolve this promptly.
Yeah, thank you, because it's been several years now. My other question was going back to the people between 10 and 12 that are being sampled. You gave us the same statistics as last month, but are there any more samples in that group that have been done since our last meeting? And how many total have been done of the total?
There may have been some done, but I don't think we have any reported. I mean, basically, Andy Fuller, our project manager, takes the most recent information that he's got, and he compiles it for the purposes of these meetings and these reports. So the numbers I've given you would be what we have officially at this point. That doesn't mean that work hasn't been done, that just simply hasn't been reported to us yet. So there's as you can imagine, there's a little bit of a lag between when the work is done and when we get the actual report and are able to then share it with this group.
Okay. Yeah, so as soon as you are able to report that would be helpful. Because again, those are the people that we're concerned about drinking water that we know may or may not be above the MCL. The other question I had was, so I guess I know the answer to this question, but since we're having some issues continuing with the company's lack of compliance with the existing law that holds them responsible for sampling everyone within the outer boundary, and I know you've been saying that they agree, but are there any steps underway to hold them responsible for making sure the closure happens that doesn't leave a bigger problem behind than we already have? So it seems like they'll say that now, but that doesn't make me feel really good when we already know that they're refusing to accept the responsibility even for what they are compelled to do right now.
Yeah, I mean, that's what yesterday's meeting was about, really beginning that process of making sure that we have continuing communications with them, that we're apprised of and aware of and verify the progress of their closure activities. So we'll be watching this closely throughout the coming year.
A follow up on that. Other existing rules in hazardous waste rules that compel them to follow any steps for financial assurances or for the steps to close that facility?
There's some general provisions about just making sure that when you close a facility, that you leave it in a condition that doesn't pose a risk to human health and the environment. There's also specific to the hazardous waste rules, and we talked about this yesterday at our meeting. What typically happens when a facility closes like that, every facility that generates hazardous waste has an EPA ID number that's assigned to them. And that number is specific to the facility, and it means that if you have a number, it suggests that you're a generator of hazardous waste. And so what typically happens is a facility, when it closes, will seek to what they call, it was termed as declassify the facility as a hazardous waste generator. So the way that that happens is that they have to remove all their wastes, certify that all their wastes have been removed, and then they ask for a declassification, have their number removed. And that, when we administer that program, and when we do that, we send inspectors to the facility to verify that all the wastes have been removed, and then decide whether it's appropriate to declassify the facility.
So a follow up on that, are they a hazardous waste facility? Then I know they have a small quantity generator status, but
they are a generator of hazardous waste, so they do have an EPA ID number, yes.
And so they have a closure plan in place and financial assurances that are required by that?
So closure plans and financial assurances or financial assurance requirements are typically associated with very specific types of hazardous waste facilities, like a hazardous waste landfill, a hazardous waste surface impoundment, or something like that. They don't, a standard generator of hazardous waste is not required to have financial assurance for closure or a specific written closure plan.
Yeah, I guess that's a concern of mine, because New Hampshire considers PFAS to be a hazardous, we have an MCL for it. So, and they're, obviously they generate a lot of that type of waste. So I don't know why there's a loophole for them to not have to comply with that requirement.
Well, it's not a loophole, because I mean, let's take it completely away from PFAS. If you had a facility that generated 50,000 gallons a week of perchloroethylene and shipped it off and disposed of it, they'd be a hazardous waste generator. They'd be subject to all the generator requirements, and they would be subject to that same process for declassification, but they wouldn't be required to have financial assurance for closure unless they were some kind of treatment, storage, or disposal facility for those wastes.
Gary, you had a question.
Well, it was answered. It was actually one of Mindy's questions that she had. So yeah, it got covered.
Okay, Laureen, I think you're somewhere here, or not here. Laureen, you raised your hand, but you disappeared.
I did. All right. I'm here. And where is the camera? You. Well, you can hear me, right?
We can hear you, yeah. Go ahead.
I hit something. There it is. All right. Okay. In the past work plans, way in the beginning, there were various data points that were requested a long time ago, including surface waters in the area, soil, both on-site, off-site, things other than drinking water. So I understand how the groundwater, the GMZ is going to work in the future, and I appreciate all the work that you're doing. But what I'm wondering is these other data points. Is there any plan, or can we expect as a community some future monitoring or ways to, really be aware of the impact? I don't know what we can do about it. And even when you look at a declassification of an EAP, ID number, that goes to the site and their use in their products mostly, right? But we all know the site is highly contaminated, the soil is contaminated, it continues to impact the brooks, the Merrimack River, or aquifers, and who knows what, I don't know what emits after air emissions, decrease. So my concern is, there's some data points that we looked at a long time ago that were very, very important from an environmental perspective and to our community and our overall burden, not just to expenses of remediation, but also to our health. So are there any plans to either gather and look at that, and potentially you may consider having a meeting with the town council, the MVD, and residents who are interested, just to discuss, what we think those data points should be, which may or may not be granted, but at least you have some input and you hear, and we get a little bit of a voice in this process. And then we will, through the course of this commission, perhaps hear, what can we expect? Because, the focus is, it's a huge focus. There's so much that's happened here in this contamination investigation, as you are well aware, but by the same respect, it's a narrow focus. There are additional data points that some haven't been done, that they were asked to a long time ago. They wiggled out of the fish testing, and there were considerations of other data points that were not completed or done just once. So that's my concern. What can we expect moving forward in terms of what we see historically here, and and even in Superfund sites, is groundwater monitoring wells, and that's it. I think we need a little more than that, or we need to understand what will be monitored so we can assure that things are getting better, because when they close, it doesn't magically make this problem go away.
Sure. Thanks for the question, Lorene. So that I want to draw a distinction too, just to be clear. I think you know this, but I want to just say it. The plant closure is really a separate matter. The site investigation, the remedial action, those things are going to be ongoing and being implemented for many years after Saint-Gobain leaves town and closes the plant. So those are not the same thing. And every communication we've had with them to date suggests that they completely understand that they still have full responsibility under the law and under the consent decree for the completing a site investigation and developing an approvable remedial action plan for the site conditions. And with respect to that, as I mentioned, we expect to see an addendum to that remedial action plan in December, submitted in December. You hear us talk a lot about groundwater, and there's a good reason for that. We're mostly concerned about groundwater because that's the exposure pathway, right? Most people, they get exposed to a contaminant, get exposed to it through their drinking water, right? So we focus a lot of resources and attention to that with good reason. But a remedial action plan and site investigation are intended to be comprehensive and addressing not only groundwater, but soil, surface water, and every other potential location that we can see contaminants migrating or causing a potential exposure. So, one of the things we're anticipating is in this RAP addendum is some more attention paid to that surface water pathway, right? To look at, what do the groundwater conditions at the site mean for impacts to nearby surface waters. And so that's one of the areas that we were looking for some more attention in the remedial action plan. So that's really, I just want to assure you that we're looking at all those things. But to be clear, when we look at potential exposures to humans, the drinking water pathway is by far and away the one that we're concerned about. It's the one that impacts the most people, and it's the one that has the potential to impact the most people adversely. So there's always going to be a strong attention paid to that.
Thank you.
Nancy.
Thank you. Just a quick question, Mike. On the EPA declassification, is that a requirement, or is that something that they can choose not to make that request?
That's a good question. We talked about it yesterday, and I think they anticipate doing that. It's and again, I'm going a little off book here because I don't know for sure. It may well be required, but it may also be a request that can be made. I will tell you, in practice, a lot of facilities that close don't get around to asking for it, and sometimes we have to kind of go after people, because we got all these numbers out there for facilities that have been closed for 10 years, and we'll make some contacts. And I mean, back when I was a hazardous waste inspector, a couple of times I ended up going to facilities that have been closed for 10 years that were long abandoned, just to verify there were no more hazardous waste there so that we could declassify the facility. So not really sure if it's a specific requirement. At some level, it's really an administrative thing. It's not super important. It's not like it changes the environmental conditions. One thing that could happen here is if they have some kind of remedial action plan that gets implemented where they are recovering wastes or recovering contaminants that could be considered a hazardous waste, they might not want to get rid of their hazardous waste EPID number, because they might, even though the facility is closed, they could be potentially shipping hazardous waste from the facility and need that EPID number in order, because you need that number whenever you ship wastes. It goes on a hazardous waste manifest. And so, you know, a lot of facilities in the past that have closed but had groundwater contamination, say they were removing chlorinated solvents from groundwater through a treatment system and shipping off contaminated carbon or something like that, they might have needed an EPID number to do that, so they would just keep the number. So it really depends.
So if it was a choice and they decided not to request that declassification, would that mean then that DES doesn't go out to do all of the checking? No.
Whether they request a declassification or not is irrelevant. We will be paying attention to this facility, and we'll be looking to make probably a number of visits, but certainly a final visit to look at the final condition that they're going to leave the facility in when they actually leave.
Okay, thank you, Mike.
Don?
Yeah, thanks. I just have a couple questions on the remedial action plan. I know you had indicated that DES had a conversation with Saint-Gobain, and they went back and they're going to submit an addendum. I was actually looking on the One Stop database. I didn't see any correspondence. Was it just a meeting? Is there any meeting notes or anything about what? I didn't know if you actually sent a letter to Saint-Gobain, or maybe I just missed something, but I was kind of looking for the content of what that discussion was, and if there was something that fell short, you know, what was it? Was there a directive or a request from DES for a pump and treat system or evaluate something like that? I just didn't know any details on that.
I don't know that there was a letter. We had a detailed meeting back on June 21st, and I will tell you one of the things that we expressed, and that was we felt that the remedial action plan that they'd submitted was deficient and that it was not going to hit the mark. And we made it really clear in that meeting that that was the case. And as a result of that conversation, they decided that they would go back to the drawing board and submit a RAP addendum. So I don't know that there was a letter necessarily that came out as a result of that, but I can check. We would certainly want to share that letter if there were one. So if there is one, I'll make sure we get it included in the notes for the next meeting.
Yeah, if you know, I was looking on One Stop. I just didn't happen to see anything, but that's good to hear. I know in the past I had public presentations done to the town. I think if I'm remembering correctly, November 4th or 5th of 2019, there was discussion about the remedial action plan. Of course, it was just a site investigation at the time, but there was discussion that a remedial action plan would be presented, and something to the scale of the groundwater contamination that we see out there. I think you had represented that you probably would expect to see something with pump and treat or something to address the groundwater. So I just wanted to make sure that wasn't lost anywhere.
No, that has not been lost. And if you know, in previous notes in today's minutes and then the minutes from today's meeting, there is a hot link for the RAP, so you can see what they submitted for a remedial action plan.
Yeah, I did see the plan. I just didn't see the letter that asked them for more information. And on that note too, can you tell me if the approval of the remedial action plan, will that include any kind of public hearing with the at the town level or anything like that, or is that, I don't know if the law requires a public hearing or if that's something DES would entertain if not required by law?
Law does not require a public hearing, but certainly I think there'll be significant interest in the content of that remedial action plan. So we could certainly have a public information meeting where there'll be an opportunity to talk about what its contents are and take questions and thoughts about that. Sure.
All right. And just one other quick question, just for my own, maybe this has been discussed and I missed it, but on all the private wells that the poets have been installed, I'm assuming, and if there is, I'm asking, what is the follow-up process for the future sampling to confirm if there's been breakthrough and when the media needs to be changed out? Is that all spelled out somewhere?
It is. There's an approved operation and maintenance plan that was submitted and that we approved that they need to follow. And so, and they're very specific. It's a little dense because for different concentrations and different circumstances, it has slightly different requirements, but on balance, it requires, periodically going, verifying the system's working, and then changing out the carbon canisters when necessary.
Yeah, you just mentioned, exactly why I asked, because obviously the raw water concentration, if it's very high versus very low, you're going to get different, times to break through. So it shouldn't be just one size fits all follow-up sampling for all wells.
Right. No, it can't be. And in fact, of course, there are, different geochemical circumstances in different waters and such. So it does have to be pretty specific to that. And so we approved a plan that we believe will ensure that, they are doing this on a frequent enough basis to ensure that people's water is being treated effectively. And it has to be said, we're going to be informed by the data that comes in from that, right? If we see data that suggests to us, well, the plan we approved isn't really effective, then we would look for a modification of the plan.
Good. And then just one last one is related to the GMZ. I know we are, we're compelling Saint-Gobain to sample more wells all the way out to the outer boundary, which I think is a good idea. And I know there are other, rebate programs for wells that are outside the outer groundwater management zone to get tested and to put in treatment and whatnot. So that's a good thing. I was just wondering, going back to, I think Ms. Messmer had forwarded some information about some evidence that was found from a different state where Saint-Gobain had represented that the actual degree of PFOA or whatever they used was actually higher than what they had represented. And if that had an effect on the delineation of the GMZ, you would think if the GMZ was modeled based on a smaller concentration that was assumed, if the concentration is actually higher, does that open up the case for looking at redelineating that GMZ, even if the settlement agreement is finalized? It's almost like you wonder if the settlement agreement was done in good faith, if that was the case. Is there anything to go back on to follow up on that?
I understand your question. I think, one benefit we did have when we negotiated that outer boundary, we had a lot of data, right? We kind of knew a lot about what we were seeing. So I'm not sure that I don't really want to comment on that because that's something that, folks could still be reviewing. But I don't think it necessarily creates a situation like that.
All right. I wouldn't see why not, but that's another question, but that's fine. I'm good. Thanks, everybody.
Any more questions from Mr. Wimsatt? I don't hear or see any. So Leanne, you're up next.
All right, good afternoon, everyone. I've got a couple of updates to share from Health and Human Services. The first is about the Merrimack cancer investigation, the phase 3 feasibility study for kidney cancer observances. So HHS is working to establish a retroactive contract with an academic partner to do that study. And due to concerns around privacy and information security, the contracting process has taken longer than we had anticipated. The study is going to be based on New Hampshire's cancer investigation protocol, which includes convening a community advisory group to encourage community engagement and participation in the process. On another note, ATSDR, the Agency for Toxic Substances and Disease Registry, finalized their health consultation for PFAS in private wells near the St. Gobain site that was just released this afternoon. So I'm not sure if you received a link to that study. I'll send my notes that also have a link to that. But this is a final version of a report. The initial report was drafted in December 2021, and they accepted public comments through March 2022, and then revised the report based on those comments. So this was ATSDR looking at health effects from exposure to PFAS in private drinking water wells near the facility. They're also working on a similar health consultation looking at exposure to PFAS in public water. But I don't know about the timing of that study. And that's all I have.
Questions for Leanne? Nancy?
Thank you. Thanks, Leanne. When you said looking at a retroactive contract, what does that mean?
So we're working with an academic partner. They've started the contracting process. I think they've started to do some planning around community engagement and maybe other pieces of the work, but not really like launch the study yet. So to do that, you have to, the contract will have to go through governor and council for approval. And so that's why it's considered retroactive.
Good. And who's been contracted to do that?
So because it's still part of contract negotiations, I can't say that, but it is a partner that's very familiar with cancer protocols and the cancer registry in New Hampshire.
Okay, great. Thank you, Leanne.
Maureen, I guess, and then Rosemary.
A couple of questions. I did get that ATSDR final report out. It was nice to see that they included the commentary from DES and private citizens and responded, so we could see a few edits that were improvements. So that was a good thing. They had told us in early 2022 that the public water report was due in October of 2022. So I don't know if you're aware that they actually gave a date. So clearly they're over a year out of date. So maybe you could get yourself or your Apple, if the Apple Tree team, I think, is still convened. They're still under their grant, right? So, we need to push them. Yeah, they have things to do, but we need to push them. The other thing that was good to see that they incorporated in the report was they referenced the NASM that they had contracted several years ago, and that was released a year and a half ago. That is of crucial interest. We have some good things. DES and DHS worked really closely with Dartmouth to do the New Hampshire specific fact sheet. And some of the folks here, Nancy and myself and a couple others in our community were involved in that. So it's a great product, right? And we struggle with how do we get that out there. But in terms of physicians, what I have found myself personally in my family and what I hear from other people is the physicians, until they have something that looks really official to them, that they can use as a tool, right? That's what they need. The NASM gives them a tool, it's very specific over the less than 2 parts in the blood, 2 to 20. It gives very clear, very easy for them to say, ooh, this is what we should do for monitoring. That's key, and that will be key for all of us forever and ever and ever. The ATSDR final report also updated their language, and they used the phrase, and they clarified on developmental impacts. That was really good to see because, we're a community, and the surrounding communities probably, I'm sure, also of, families such as mine back in the day, came here to raise their families and to have a good life and a healthy life. So the developmental considerations and the guidance, I think, in my opinion, all the literature I've seen, or fact sheet is great. The ATSDR physician guidance it's information that's familiar to me, by golly, but it isn't really as applicable as we need. I would really ask that maybe the commission consider writing a letter for all it's worth, the state, any suggestions or work we can do all together on really pushing for them to incorporate the NASM. A year and a half is plenty time. They were supposed to adopt that, as a matter of fact, by fall of 2022. And ATSDR gave that specific date to me back last year. So we need that. We need that tool. It's crucial. I know these things take way too long, but we're 7.5 years into learning of our exposure. We see the impacts, as I know you've heard from us over and over and over. We see them everywhere. We hear about new health situations continually. Many people here have had additional health conditions. Some of us know of each other's health histories just in the last even couple years, in our families. It's just on and on and on. So the NASM, with that applicable formula that they have in there that's very accessible, is really, it's so important to us. Above all, above everything we do, that's what we need, because we need to know that we're being vigilant, which sounds, watch your health. That's a very general phrase, but we need to be specific and know what we're monitoring for and why, and how we can prevent progression of disease, and also how disease can be spotted. What I have noted out there is certain things that seem very problematic from an endocrine perspective in particular, that are precursors to, other things, not just thyroid, but cardiovascular, a lot of cardiovascular impacts in this area. We can prevent if we can be validated. And the specific health protocols that are out there that PCPs are guided by, they're very valid, of course, right? That's medicine. But what you look at typically is not really the case. Like, for example, if you have a nodule in a thyroid and it looks problematic, the Endocrine Society will tell you this is slow growing, we can monitor it. They have this whole set of protocol that I've heard from endocrinologists. But if you have had decades of PFOA exposure, your thyroid is not going to behave itself like the research has said. And the research has been there for decades. This is nothing new, but we are atypical. So that's the part I just want you to keep in mind. Everybody's doing a great job all in their little corners of PFAS, right? But at the end of the day, what we're not getting here is that monitoring and guidance that we need. And maybe we can form, some sort of a work group to look at how we're going to do that. But at the least, I would love it if you could push the CDC, ATSDR, because the NASM recommendations are very clear. They're excellent, and I feel really good about them. And if they were incorporated by physicians, I know my family would be better served, and everyone. Thank you. I know that was windy, but it's such a hard topic. And I talk to people all the time, not just personally in the community as a resource, but in my work as a clinical social worker. Every day I have this issue before me. Thank you.
Rosemary.
Yeah, thank you, Chris. Leanne, I have could you clarify a little bit more about the cancer study contract? Did it go out for bid, and DHHS has accepted a proposal, and then it's going to the governor and council? How did that process go?
My understanding is that it is a sole source contract that they've been working on. So it hasn't been approved. It does have to go to a governor and council and go through that approval process before anything is official.
Okay. And then I'm kind of curious about, did everybody here just raise your hand? I mean, I got that report, that email this afternoon. You couldn't see who it was sent to, so I was just wondering if it was sent to all the commissioners that are on here. And I'll plan to, communicate that out to the community too, because I do think for private well owners, it's important information for them to have. And I would encourage, Chris, you might want to, get it out into Bedford too.
Yes. Yeah.
Actually, Chris, if you could send it to the whole commission, that would be great, because I did not receive it.
Okay.
Oh, okay.
Yeah, nor did I. So.
Oh, okay. I'll forward it out right now.
Is there a way to put something in the chat? Because I could put it in the chat for the
I can do
meeting.
that. Yep.
Does
I
that work? Let's see. Do I have the ability to do that? Let's see if that's.
Yeah, it came from a Christopher Mugford.
I can forward it as well. I have it open.
Okay. Okay, yep, that's it. That's all I had, Chris, thanks.
Okay. I think I just want to make sure that I can, yep, okay, got it. Gary, you had your hand up, I think.
Yeah, just a quick sidebar. Who will have control of the data? The state or the agency or academic agency that you're working with? This became a sticking point when I was in the House. We were trying to get a particular study done, and HHS had concerns about where the data resided and who had control, which shouldn't be a major issue, but nevertheless, it became an issue.
Yeah, I think that's part of what they're working on right now as part of that
Okay.
contracting process to make sure that,
Okay.
you know, any data are secure and, you know, there's no privacy violations associated with that. And so I think that's exactly what they're trying to work on right
Okay.
now.
All right, thanks.
Okay. Any other questions for Leanne? Okay. If not, we'll move on to Maureen. You have updates for us on legislation?
Yes, thank you, Mr. Chairman, and good afternoon, members. We have a 2023 legislation tracker sheet that is almost complete. And then we have the 2024 tracking sheet that is anything but complete because it only has the LSR numbers and titles, barely anything else, no Senate bills yet. So we'll focus today on cleaning up the 2023 chart, which there are some updates. So today is actually the deadline on the 2024. So hopefully after today, we'll have more on that chart. But again, getting back to the 2023, I'd like to start with the retained bills on that chart that were not recommended by our last meeting. The first one is House Bill 398. That is an act relative to notice of PFAS and other groundwater contamination prior to the sale of real property. So that was in the Resources, Recreation, and Development Committee, and it came out ought to pass with amendment recommendation 20-0 on the consent calendar. So there will be more on that to come as the full House meets early next year in January. But that came out of committee pretty clean, ought to pass with amendment. I put a link to the amendment in the chart in the row for House Bill 398. Moving on, House Bill 414. That is an act relative to health insurance coverage for preventative PFAS care. It was in the Commerce Committee, and I was only able to get the recommendations from a member of the Commerce Committee because they do not appear on the dockets yet. But I was told that that was recommended ITL and that it was a bipartisan motion. Next, House Bill 242. That is an act relative to banning PFAS in food packaging. Again, in Commerce Committee. Again, the docket is not complete. I was told it's a recommended interim study by a bipartisan vote. That, for those who may need a refresher, is a motion that only can be made for bills headed into the second year, similar to retained bill in the first year, but interim study concludes in the second year with either a recommendation for future legislation or not. House Bill 465. That is an act restricting use of PFAS substances in certain consumer products. Again, in the Commerce Committee, again, in an incomplete docket. But I was told by a member it was recommended interim study by a bipartisan vote. And again, that was relayed to me by a member of House Commerce. So I'd like to leave on an up note, and that is to just clarify House Bill 614. That was making an appropriation to the Department of Health and Human Services to fund the Merrimack, New Hampshire Kidney Cancer Incidence Phase 3 feasibility study. Now, as a reminder, that is all set. That bill was completely incorporated in House Bill 2 that was signed by the governor on June 20th, 2023. It is law. We had a report about it earlier. It is golden. However, take note, the Finance Committee did recommend that House Bill 614 be ITL 25-0 as a protocol, because every bill needs to have a recommendation to conclude it at the end of its year. And so because it appears in House Bill 2 and it's already law, the likely recommendation was an ITL. So please don't be concerned about that, because it's taken care of. I have other bills in similar situations to that, and I get calls all the time with great concerns, but it has a very positive ending because, again, it's law in House Bill 2. With that, I will conclude my report. Thank you, Mr. Chair. Thank you, members.
Thank you. Questions for Maureen? Okay, I don't see any, but Maureen, could you just explain the life of interim study, what happens for the remainder of this session?
Sure. So an interim study motion is in House rules as only applicable for bills in the second year. So because we're coming up on the second year of the term, that's an appropriate motion. Unlike a motion to retain, the motion for interim study goes to the House floor. So the House as a whole would have to approve a committee's recommendation for interim study or not, or reject it with another motion. Again, that's different from retain, because retain motion never goes to the full floor. It stays in committee, as these bills I just discussed had a retain in the first year. So interim study, if that were to be approved by the full House, that bill would essentially remain in its committee and be studied at the determination of the chair to any degree, and then eventually be given a recommendation. And that recommendation would either be refer or approve for future legislation, or not recommend or refer to future legislation. Some call it a slow death, and that may be an appropriate description.
Thank you. And when you mentioned the deadline, does that apply to the Senate as well for submitting legislation?
The deadline today, November 17th, is in the House rules. I am unsure about the Senate rules. Those are a little different. The deadline today is relative to bills that would be introduced next year. So those will be the new bills that right now we only know by titles. But I believe the Senate deadline could very well be different from today's deadline.
All right. Lastly, just comment that's very good news about HB 398. Some of us just experienced about a month ago a flurry of email from somebody who moved to Bedford and was clearly within 500 feet of wells that had tested positive. Their particular house had one sampling and it was not positive, and they were very upset to not have been told by their seller that they were near some wells that had tested above MCL. So we appear to be headed towards some improvement. So that's great. Moving along, number 6 on our agenda is possible soil testing near the Saint-Gobain site. And that sort of segues into what you had said, or from what you had said, Laureen, about getting some additional data points. And I bring this up for a number of reasons. One, our primary responsibility is to the towns in the study commission area. And there are, some hot spots where we see lots of red and orange dots, and we haven't taken too deep of a dive beyond the site itself. And I think in this last year that we're around, it would be good to get some data on that for a number of reasons. And the request is also informed by the resampling studies that we have done. Of the 10 to 12s, only 29% have gone down. So it's clearly very persistent in the environment. Even those 0 to 10s, we have some exceeding MCLs, the existing MCLs. So there's clearly some significant residue entering the drinking water, groundwater wells from what's out there. And on resampling, we don't know if it's just, a particular day, a particular time. Did one household have 2 showers and 2 loads of wash right before the sampling? Or, it's hard and not even worth asking those questions. But I think we ought to do some study. I single out wetlands and storm water retention basins, partly because the Sackett decision might affect things farther away, but also it's an environment where PFAS chemicals might be mobilized, not quite as much as surface water, but clearly we have things moving throughout the soils. And I think if we did a little sampling, it would give us at least a basis for a hypothesis of what might go on farther from the plant in the GMZ, but also farther in the state. So if we do this testing, and we might find it inconclusive, we might find there's nothing to worry about, we might find there's a lot to worry about, but in a very crude way, in this 1 year that we have left as a study commission, I think that would be some really useful data to have. I always used to dislike it when somebody on the town council said you can find money in the budget to do that. So I don't know if there's money in the budget to do that, but I think we would gain some really valuable data. So I would encourage that, Mike.
Chris, I had a quick question if possible.
Yeah, Michael Strand.
And sorry to be late to the party here today, guys, just had a work conflict. I had a question actually, not to go backwards, but for Representative Mooney, with regard to a couple of the bills, and short answer is totally fine. Just wanted to get a sense of the pushback or the resistance you're getting on a couple of bills related to consumer protection or use in consumer products and then food packaging. I'm just curious what the rebuttal is to that, this rendering them either inexpedient to legislate or where that argument lies, I guess.
Thank you. So specifically the bills related to food packaging and consumer products. Those, as I understand it from Commerce, were interim study. And I didn't catch the debate on that, but when it's written up as a committee report, because that motion does go to the floor, it will be in the House calendar when we meet in January. Hopefully there'll be some clarification there beyond the debate. So I'm sorry I couldn't. I'm sorry I couldn't. Yeah.
No, that's okay. I appreciate it. I'm just curious if it's running, through the, along similar, veins as prior, anti, business oriented or too much of a barrier. If that's the rhetoric that you're seeing or we'd expect to see, or if there is, something beyond that actually would be any reason to not regulate this stuff.
Rosemary.
To answer your question, Michael, some of the bills that went before Commerce that are being recommended interim study, there's actually been work done on those already through the Solid Waste Commission, and they've been filed as LSRs for this coming year. So I think if you go to the New Hampshire General Court website, kind of like midway, it'll say LSRs filed for 2024. you can scan the titles. I mean, there's several hundred, but you can scan the titles and see what PFAS legislation's been filed. But some of those bills that were interim study have actually been improved and resubmitted.
Okay, thank you. That's very helpful.
If I could just add to that, also in my chart, the nutshell version is in the 2024 PFAS chart by title only and sponsor. And if I could figure out the chat feature here, I will send a link to the full list of LSRs.
Appreciate it. Definitely keep, myself and Lori and others in the loop if, you're starting to see, the dialogue or the rhetoric on that flesh out, if there is any, opportunity for public relations or communications to try and help that cause.
Rosemary.
Yeah, and what will be really important, Michael, is like today's the last day for House members to sign off as sponsors or co-sponsors for these LSRs. Once it gets introduced in the House in early January, the LSRs get converted to a bill. They're assigned a bill number in a committee, and the full text will be available to the public. Right now, the only people who've seen the full text are sponsors and co-sponsors. But once it gets to the, once it gets introduced to the House and assigned to committees, a very important part of the process is public hearings and having people come to testify, provide written testimony, at the minimum, just sign in support of the bill. So we'll definitely keep you abreast of that. But the General Court website has made a lot of improvements to make tracking the progress of those bills easier.
Yeah, definitely aware of that. I appreciate it. The reason for the question, and sorry to hold you guys up, we'll move on, but was recently, I think I had heard Senator Ricciardi, I don't know if she's with us today, had expressed that she was not either not co-sponsoring, but I think not in favor of, I want to say it was either the food packaging or the restriction in consumer products legislation. So maybe I'll just ask her, but I was curious, just what that conversation is looking like.
Yeah. And the devil's in the details. I mean, there's some bills that the title, it sounds really good, but when you get into the bill, you realize there's no enforcement mechanism. There's no consequences. So there could be unintended consequences the bill creates, which may make people who support PFAS restrictions, take have second thoughts about it. So it really depends on the language.
Definitely makes sense.
Okay. Is there new business that anyone would like to bring up? If not, our next meeting comes very quickly, December 8th at 1 p.m. So hopefully see you all there, and have a happy Thanksgiving. We don't have any public comments. And so at this point we can, I don't know, I guess I'll take a motion to adjourn. Why not? Motion by Rosemary, second by Gary. All those in favor, please raise your hands. Thank you. Thank you, everyone. Happy Thanksgiving.
Happy Thanksgiving,
Happy
everyone.
Thanksgiving, everybody. Thank you.
Thanksgiving, guys.
Bye.
Happy Thanksgiving, thanks.